watching CBS 2 News in high definition.
A seemingly minor heart problem turns out to be a leading cause of stroke and disability in this country.
It is atrial fibrillation, or AFib, but as CBS 2's Dr. Max Gomez tells us that there is now a minimally invasive procedure that can eliminate that stroke risk. Dr. Max?
That's right, Christine. You know, more than 2.5 million Americans have atrial fibrillation, and AFib patients have up to 7 times the risk of having a stroke as the general population. There are drugs to reduce that risk, but with possibly serious side effects. Here's another way.
I was passing out. I was having fainting spells.
That's how Frank Hirsch described the AFib symptoms he developed after 2 heart attacks, a pacemaker, and a defibrillator. He was taking blood thinners to prevent AFib blood clots, but they were causing serious bleeding.
Blood was gushing out of me, 12 pints of blood in 7 weeks.
But going off blood thinners risked a stroke. AFib causes blood to stagnate in the heart, which then clots. If it breaks loose, it can travel to the brain, causing a stroke.
It's a classic rock and a hard place because they're at risk of a clot causing a stroke, but they can't take blood thinners either.
It turns out that 90% of AFib blood clot strokes come from a small, normally occurring heart pouch called the atrial appendage. Open heart surgery could cut off the appendage, but that's a big operation. Now there's an easier way. It's a minimally invasive procedure called the heart Lariat. Yes, it's a lasso for the heart. First, a long catheter is threaded up from the groin and into the appendage. Then, through a small incision between the ribs, a loop is placed around the appendage. The balloon is there to help placement. The noose is tightened and cut, and the appendage slowly withers away.
Once that appendage is tied off, blood can't enter or leave, and therefore we don't have to worry about blood clots exiting the appendage and going to the brain.
Hirsch had the Lariat just 3 days ago.
It is a tremendous load off my mind. Just to know that I don't have to take the blood thinners.
Now, the heart Lariat doesn't stop the atrial fibrillation, but it does eliminate most or all of the stroke risk from AFib, so patients can go off their blood thinners. It's not for most AFib patients, but for those who can't take the drugs and have risk factors for a stroke, this could be a lifesaver. Maurice, Christine?
Nice to have that option, Dr. Max. Thank you.